Mr. Shawn Huang.
Mr. Speaker, I'd like to express my sincere thanks and appreciation to the committee for their tireless efforts in putting together this report. The report provides valuable insights into the challenges we faced during the pandemic, the measures taken, and the lessons learned. Operating in a dynamic environment with evolving knowledge and understanding of the virus is challenging. The pandemic has been an unprecedented global crisis. It has impacted all our lives, from healthcare to the economy, and tested our social cohesion and Singapore's resilience and agility as a nation. It emphasized the need for cooperation and partnerships between the government, businesses, and individuals. And we have done remarkably well in our response to the pandemic. In the healthcare domain, there are 4 key issues: continued access to healthcare, resources to ensure the survival of Singaporeans stricken with COVID, testing capabilities, and vaccinations. To do this, we needed trained workforce, space, equipment, and essential medical supplies such as vaccines. And to mention that, Singapore was among the first to secure and administer vaccinations to protect our citizens. I would like to applaud the Planning Group for Vaccines and Therapeutics for being able to pick up 2 of the 35 other potential candidates during the early stages of vaccine trials that enabled us to have early access. We may not be as fortunate in the future. Singapore was able to build up COVID testing capabilities, and for this to occur, it required PCR testing kits, swab kits, PCR machines, trained personnel, and a well-coordinated logistics capability. Without one of these, large-scale testing would not have been possible. Scaling up COVID testing was nearly insurmountable, given the backdrop of scarce resources and a few trained personnel. Despite all these challenges, Singapore was able to build up a testing capacity of up to 60,000 tests a day. So in light of this, in preparation for future pandemics, how could we build up capabilities within Singapore to develop and manufacture vaccines here? Do we have sufficient capacity or ability to retool and manufacture these testing capabilities locally? On access to food, water, and other essentials, throughout the pandemic, Singaporeans had uninterrupted access to food, water, and essential items. However, we cannot take this for granted and assume that the global supply chain will remain intact, with ports, ships, airports, and air cargo operating normally. Our continued access to essentials was possible because Singapore's robust supply chain management system could quickly adapt to the pandemic's changing circumstances. In addition, the government worked closely with local businesses and international partners to establish safe corridors for transit. The litmus test was when Singaporeans was able to walk into heartland markets, NTUC, Sheng Siong, Cold Storage, and all the shelves were stocked. I would like to thank those silent heroes at the front lines of procurement, those unsung heroes on the ground who secured those essential supplies and their safe passage to Singapore. In the future, circumstances and scenarios may restrict or disrupt our accessibility to essential resources. How can we better onshore or nearshore resources to buffer our resilience further? Can Singaporeans play an active role in building buffers within households? And if so, what is this list of resources, items, and capabilities that citizens can help to stockpile and maintain? Every National Day, we should allocate time to have a nationwide exercise. Every citizen, community, private and public sector can participate in an emergency exercise, a time where we review and refresh procedures, trial our national emergency capabilities, and examine our own household resilience through education and active participation. On safeguarding our industries and livelihoods, one key aspect of safeguarding local industries was Singapore's agility in locally retooling and building COVID capabilities. Companies such as Racer Technologies quickly built up manufacturing capabilities to produce masks. Hope Technique designed and retrofitted COVID buses with high-flow HVAC systems to transport patients. Mirexis, who developed COVID testing kits. And Singapore Airlines redeployed its pilots and cabin crew to provide essential services such as contact tracing and patient care. Numerous SMEs and business owners responded to the call of duty. Without hesitation, they invested their monies to secure scarce resources and manufacturing equipment and quickly onshore these capabilities for Singapore, producing masks, testing kits, PCR machines, and many more. I want to take this opportunity to thank the SME business owners for your service and personal sacrifice. On safeguarding our heartlands and community, Jurong Spring has one of the busiest markets. I personally observed how COVID-19 affected hawkers and store owners. I must share that the Ministry of Sustainability and Environment, MSE, played a critical role in coordinating and implementing safe management measures and vaccination differentiated safe management measures, VDS and SMMs, in public spaces. At the height of the pandemic, over 3,000 safe distancing ambassadors and enforcement officers were deployed daily at public areas such as malls, parks, hawker centres, coffee shops to ensure compliance with SMMs and VDS. In addition, there are over 114 hawker centres and wet markets in over 1,200 coffee shops. This is no mean feat. Overall in Jurong Spring, 0 COVID deaths within the market and hawker centres, and all hawker centres and markets remain open till today. No one went out of business. This was because MSE officers had a close working relationship with the hawkers and market stall holders. There was this deep trust in their working relationship. The officers were understanding, pragmatic, and agile in their execution to ensure that operations were conducted safely, but yet nuanced with commercial and economic practicalities when possible. This strong working relationship was further validated when collectively, together with the local community, NEA and SFA, conducted intensive outreach efforts and achieved a 99.9% vaccination rate among stallholders rapidly. Between July 2021 and February 2022, NEA and SFA also worked with the Health Promotion Board to implement the RRT, which is the rostered routine testing, which regularly tested over 24,000 hawkers and stakeholders at markets and hawker centres, as well as some 39,000 workers in food courts and coffee shops. One of these RRT centres were actually just behind the 505 market in Jurong Spring. And these efforts actually helped to prevent the spread of COVID-19 within the community and safeguard the health of stallholders and patrons. Operations in the local and regional testing centre were strategically located and professionally operated. On behalf of my hawkers and stallholders, I'd like to thank all MSE, NEA, and SFA staff who have been very hard at work on the ground with much personal sacrifice to ensure the continued safe operations of our hawker and market centres. And to enhance preparedness in our community areas for the future, could we include pandemic scenarios in the future planning of our hawkers and market centres? Our heartland shops were also deeply affected by COVID-19, but the impact was quickly mitigated with swift and professional response by MCI. MCI played a crucial role in supporting the digitalization of heartland shops in Singapore during the COVID-19 pandemic. And this was in response to the need to enable heartland shops to operate remotely and maintain their businesses during the pandemic. I remember how useful it was to the hawkers when MCI launched the Hawkers Go digital program in June 2020. It quickly enabled my hawkers and my heartland businesses to digitalize their operations overnight and adopt e-commerce capability. My hawkers were very supportive of this program and provided end-to-end support with funding, education, and as a result, numerous heartland businesses were able to adopt digital solutions such as e-payments, online ordering platforms, and delivery services. All these would not have been possible or accessible to them. But after digitalization, hawkers needed a platform to sell. Once again, MCI stepped in to assist. They worked with industry partners to develop digital tools and platforms that supported heartland businesses and brought their products and services to the market. For example, MCI collaborated with the food platform Grab and to launch Grab Food, Hawker Picks. And this service gave customers a curated list of hawker stores for delivery and takeaway. Our seniors were also greatly affected. Many of them never had a smartphone in their lives. So yet again, MCI, together with the volunteers, worked hard to increase digital adoption among seniors and vulnerable groups during the pandemic and launched a Digital Ambassadors Program, which recruited and trained volunteers to help seniors. It has benefited my residents a great deal. As a result, today we have a better and well-connected senior population than ever before. Most of them are able to use Zoom, WhatsApp, TikTok, even Facebook as well, to connect and progress and find new friends and extend their network. There's much to be appreciated for. Many of our lives here were safeguarded by the collective actions of frontline staff, unsung heroes from the public and private sector, community volunteers, and caring neighbors. It wasn't a perfect outcome, but there was every intent to ensure that we achieved the best possible outcome and for Singapore to survive. Lives and livelihoods is what we are accountable for, and that is what matters most. We've done well. There's still much to learn and prepare for the future, and the work of building for tomorrow continues. Mr. Speaker, I support.